This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hello and welcome. This is Gregg Cooper from the Norton Neuroscience Institute in Louisville, Kentucky. Today I have the great pleasure to speak with Gregg Day of Mayo Clinic about his paper published in Neurology, The Neurologist's Role in Promoting Brain Health. Gregg, thank you for joining us today.
Thank you for the invitation. Great to be on this side of the microphone.
With all the interest in brain health, including within our own academy, this paper immediately caught my attention. I wonder if you could begin by telling me what you and your authors were hoping to accomplish with this manuscript.
We appreciate that brain health is a complex issue. For many of us, it's something we're only beginning to learn about. And I think that's actually the truth across the AAN and the organization. And as we learn about it, we are understanding it's going to need a multidisciplinary, collaborative approach. It's going to integrate professionals across fields and ultimately involve public policy organizations as well if we want to affect meaningful change. But as neurologists, really, we're uniquely positioned. We are the specialists in brain health, and I'm going to argue we should be the vanguards of brain health as well. We have a role and a responsibility, I think, to take ownership of that. We want to advance this newly evolving field, and we want to ensure that it meets the needs of our patients, the patients we care for with neurologic diseases, and ultimately, I guess, if we're doing our job really well, meet the needs of patients that are yet to be our patients, those we'll meet in the near future. Lots can be said about brain health. Lots has been said about this, and other disciplines and subspecialties write about this frequently. The AAN has recognized that, and ultimately the AAN Quality Committee asked us to form an author team to summarize what is known and, importantly, what is not known concerning factors that might protect brain function. And the focus in this document, and the work that we want to do is what is the role of the neurologist in this process? And we maintain an even stronger focus on trying to inform a practical approach to that. So what are the things that we can effect now, the behaviors that we can change in our clinic that may make a meaningful difference for patients?
Is this part of the larger AAN Brain Health Initiative, would you say?
Absolutely. So brain health has been elevated within the AAN and is now a part of the mission statement. So if you're paying attention, you probably noticed that change over the recent past. And the AAN's mission statement is explicitly to enhance member career fulfillment and promote brain health for all. And the AAN is relentless in pursuit of this mission. They've created a 5-year strategic plan. It includes this big picture goal of improving neurological health for all. And what does that mean? Well, embedded within this is the AAN's Brain Health Initiative. This was launched in 2022 with the goals and objectives that are laid out in a paper published in 2023 by our now President-elect Natalia Rost. And really, this includes our member and consensus-driven definition of brain health. What are we all trying to achieve? And this is, in theory, a continuous state of attaining and maintaining the optimal neurologic function that best supports one's physical, mental, and social well-being through every stage of life. This is a lifespan perspective where we work to ensure that our patients achieve their optimal function, and then we continue working with them to ensure that they maintain that over time.
I thought one of the real accomplishments of this paper is that it took a pretty large, could even describe it as a vague concept, brain health, and made it tangible for the practicing clinician. And with that said, can you describe the mnemonic device, Safest Brains, just a bit?
This is probably as good a time as any for me to interject that this is an incredible collaborative project. I had the pleasure of working with an amazing author team led by an incredibly passionate and well-informed first author. This is Dr. Selwa from the University of Michigan. And she, along with others, came up with this very clever mnemonic. Like them or leave them, but acronyms we know are commonplace in medicine, and a good acronym or a good mnemonic can help to unify, as you've pointed out, broad and sometimes seemingly disparate concepts, can help us to remember that, recall that, and in theory, implemented in our clinical practice as well. And so with all the credit there, the Safest Brains mnemonic, we present that as a way to organize and support brain health implementation in the clinic, emphasizing factors that evidence, I think right now, trends toward or supports the role of sleep, affect, which includes mood and mental health, food, and that includes diet and supplements, exercise, social interactions, trauma avoidance, and that's the safest, and then blood pressure, surveilling for risk factors like metabolic and genetic factors, affordability and adherence, so thinking about cost of medications, infection prevention, negative exposures, and importantly, structural, social determinants of health. And that's where we get the brains from. And so we can put that together as a way to really be thoughtful and hopefully comprehensive. And if we can remember that, if we can write it out in our daily practice, we can check those things off the list as we're really asking how can we make a difference in the brain health of our patients.
And I think, as you already alluded to, you really had an all-star team to put this together. Tell us a little bit about how you landed on these particular items, maybe the process behind this.
I think our listeners that caught your last podcast on the Livingston criteria are going to be familiar with various approaches to this, systematic reviews that consider all the bottom-up evidence that's available and bring that forward and kind of weight things at different life stages. What we're presenting here, this is an emerging issues in neurology document. And so this is not intended to replace a guideline document. Often it's something we're going to bring forward before we have enough structured data to move through a systematic review process leading to recommendations, et cetera, et cetera. So really, I think what we're presenting here is what I'll call a 10,000-foot view, looking kind of down from the field, from our area of expertise, from the knowledge that's represented on this author panel, to grasp at some of those factors that we expect are going to make a difference to development and maintenance of brain factor, that are going to make a difference to the development and maintenance of brain function. This is the benefit of an engaged, representative author team that includes neurologists from multiple areas of practice, caring for patients that really do span that lifespan. We've got fetal medicine somewhat represented here, pediatric neurology, midlife, and a whole array of subspecialties, and then our late life, our senescence phase, including behavioral neurologists like me on the team here. The caveat to this is largely a top-down approach. So it's informed by experience and relevant literature. There is literature to support each of these factors, but the quality of that data, we can wax and wane poetic on that, but we really should simply acknowledge there is now a role for further bottom-up study. We want to look at the evidence that's out there. We want to use that to drive more refined recommendations and highlight areas where we're uncertain whether there's benefit and at which phase in life we'd have to make some of these changes to lead to those improvements. So there's a lot of work yet to come. This is a good start as we work to frame the issues and present these as some possible practical factors that we can surveil.
I think that strength of the paper really is the generalizability of this mnemonic and the strategies across a broad range of settings. And that probably reflects the broad representation of the group that put this together. And for those listening, I would really strongly encourage you to look at this article and look at Table 1 in particular for some practical guidance there. With that said, we're in a field that seems to be increasingly dominated by subspecialization. Do you feel like this mnemonic or this framework will still apply to some of us in narrower subspecialty practices?
I see patients late in life, and probably much like you. My average age in the clinic is going to be 65 plus, and certainly, my first reflex response, and maybe the reflex response of many of my colleagues in looking at this. Well, some of these factors matter to my patients, but not all. And there's some truth to that statement in our hyper subspecialized practice. I think we can all, as subspecialists or as a comprehensive neurologist seeing patients across the spectrum, can pick and choose depending on the consult that we're seeing. But the reality still is that while my patient might be 65 years, who's sitting next to them? Maybe it's their spouse, fine, in the same age group. Maybe it's an adult child. And I think we both know when we're presenting that diagnosis of a dementing syndrome, one of the top questions we get from that next generation is, what can I do to change my risk? And we can reframe that. We should reframe that, because really what we're being asked is, what can I do to keep my brain healthy, to avoid this from happening, but also to maintain my top potential? And so that's where the rest of the things in this mnemonic become useful for me. If I'm providing advice, it's usually free advice at that point, but we're providing advice to the next generation. This is what I'm going to draw on. I'm going to think about some of those other factors. And in all of our subspecialties, I think we have a role to think about prevention. So what can we do now to prevent problems in the brain? And that might be primary prevention or secondary prevention. So it could involve some screening for factors that are on this list that could change the trajectory of disease. But we also want to simply look for things. We want to treat things that exist so that patients with neurologic diseases have better quality. Again, that maintained function. If we have a neurodegenerative process going on, if we're dealing with seizures, maybe we have an autoimmune process or someone with vascular disease of the brain, I think treating these other things is going to yield or lead to a better outcome in the long run. And so that's the idea here, this multifaceted approach to patients, really working all the different angles that we have, using all the tools in our armamentarium. And Some we might use more frequently than others, but the rest do come up from time to time, and sometimes just in counseling that other family member sitting next to our patient.
I think it would be fair to say then having this broad framework that then we can apply to the specifics of any individual situation differently is a strength of the whole model. Do you think that's correct?
I think that's the right statement. I mean, like anything, this is not meant to be prescriptive. This is meant to, I think, inspire discussion like we're having right now. Inspire discussion with us and our care team and our colleagues in our hospital to ask, what do we already do a good job of? What can we do better with in the future? And what are the other things that we need, the tools that we need, diagnostic tests that we need, support that we need, or access to other resources to help enable our patients to achieve their top potential and then keep that top potential as they age through the entire lifespan.
Also really appreciated in table 3 of the article, there's a sample questionnaire documentation, which to me was akin to a review of systems for brain health. Should we be implementing something like that now as a standard within our practices? Are we really just at the point of starting that conversation, do you believe?
Well, I think it's maybe somewhere in between those two possibilities. And this table, again, goes to the brilliant mind of Dr. Salwa in pulling this together. I think I'm going to convey this, and we convey this in the paper as an exemplar. It's merely meant to sort of showcase what can we do with this information now in the clinic. And what that table is, it's a set of questions that any of us could be asking in a clinical environment, or could even have a team member hand to the patient and anyone else who's joining them for the visit in the waiting room to complete before they come in to see us. And it's meant to simply showcase how simply and quickly we can screen for these various domains across the safest brain's mnemonic. And so we could potentially flag concerns that we don't even know exist, and maybe in the time constraints of our visit, we wouldn't get to throughout that visit. Yet this information could point us in the direction of an intervention that might help to support future brain health for our patients. What we need to do next with this, I think this questionnaire is a great place to start and could be validated. We could roll it out, see how it performs, improve it further. It could be adapted by other interested groups. And I think, sure, there's other questions, other ways to get at this information, and that's going to be worthy of considering as we take the next steps in this program.
Social determinants of health are repeatedly referenced in this paper, and I think rightly so. But I fear that for many busy clinicians, this still remains too abstract of a concept. How can we do a better job of implementing consideration of these determinants in our practice?
That's absolutely a challenge. I mean, when we talk about social and structural determinants of health, I mean, I think we're trying to encapsulate that whole broad range of social, economic, environmental, sociocultural, and system-based constraints that influence access to care, even health literacy, health-seeking behaviors, and this varies widely. We appreciate the impact of certain social structural factors maybe more than others. We talk about food deserts or even accessing pharmacies and other resources that are around us. I think more than the neurologist structurally assessing these things on an ongoing visit, it's maintaining a mindfulness of it. Asking our patients, if we're prescribing a medication, where are they going to get this filled? Does it need to be taken with food? How convenient is that going to be for you? Do you have access to appropriate nutrition? Maybe even more important in patients with certain neurodegenerative, neuromuscular disorders, patients who may be thinking about conceiving and for the next generation. And so beginning to integrate these things throughout our work order and thinking about how these barriers can contribute to disparities in neurologic care is the beginning of a more healthy process. Ultimately, of course, we hope that our health systems, the promise of electronic medical record, whether that's been fulfilled or not, may help us to gather some of these and flag patients that are perhaps at higher risk. But the reality is that I think that's yet to be realized, which is why these things remain nebulous. But just because they're nebulous, hard to characterize, we certainly don't want it to be left out. And so they show up in safest brains. They're the final S, but they're integrated throughout the document, as I think they should be integrated throughout our approach to our patients.
You also reference the SACO Scholars Program in Brain Health, and I realize that's not the main thrust of the paper, but I think it'd be informative if you could say just a little bit about this program. It's an important new initiative within the Academy.
Right. In this manuscript, we pull this into sort of the future directions, and I think this is another positive step forward. When we talk about where do we want to go next and what do we need to really bring this vision of brain health for all forward, we need trained individuals, experts that focus on brain health and further develop preventive medicine as a strategy that we can all roll out that bring us tools that we can integrate into our practices wherever they may be. The SACO Scholars Program, made possible by a generous bequest to the AAN and American Heart Association, so a partnership there by our late great AAN president, Dr. Ralph Sacco, who was also at one point was the president of the American Heart Association, a remarkable achievement few of us can conceptualize of. The scholarships are jointly funded by the AAN and the AHA, and it's a fitting way to continue Dr. Sacco's legacy in partnership with both organizations. And so practically, these award scholarships of $150,000 each year to two awardees. And the first ones were rolled out this past July. The applications for 2024 are just wrapping up, and the awards will go out soon for 2025. So stay tuned to find out who our next leaders in this field will be. But I think this really is an exceptional program. It's bringing forward new opportunities for people that want to take the next steps and become leaders in this important field of brain health.
I think it's really an exciting time, really within the academy and within the field of brain health in general. I'm curious, is the quality committee have additional steps they're hoping to take, or what might be some of the next steps you expect?
I love the forward-thinking perspective here, and that's what we want readers to come away with when they finish this manuscript, is questions that need to be answered, and this perception that we are beginning on a journey and need to take the next step. The quality committee within the AAN is going to be one of the partners, I think, in taking this next step. There's also a brain health committee, and so we're looking forward to partnerships and continued partnerships as we look to realize this key pillar of the AAN mission. I think we have some pretty clear next steps, and there's some great roles for both committees and other aspects of the AAN here. I mean, one, we need to develop tools that are going to help us quantify brain health. If we're going to set goals, we want to know how we can measure those goals and measure progress towards those goals. We want those measures to be validated, and that's an ongoing and very active initiative that I think we're going to be hearing more about and be a great topic for future podcasts. We also want to have influence in the education spectrum. And so the SACO Scholar Program, that's one opportunity to expand research, to develop future leaders and educators. But we all have roles as neurologists. We interact with medical students, residents, fellows all of the time. I think we're going to see an increased focus in this field of preventive neurology. And as the AAN and as vanguards of brain health, we want to have a very active role in developing that curriculum and ensuring that we maintain that focus and the priority on our patients' health going forward within that sphere. There's also roles, and there will be roles for continued collaborations in other specialties. So thinking family practice, obstetrics, and gynecology, when we're thinking about trying to ensure development of the brain, I mean, we can expand that list further to many other partner organizations. And the AAN will play a key role in brokering some of those partnerships as well as these subcommittees. And we continue to advocate from a policy standpoint too. And so I want to see more integration across there. When people think about the Quality Committee, they think about guidelines. And one of the top products that Quality Committee develops, I mean, there's actually many of it. We love the guidelines. And we do want to see guidelines come out that really frame some of these issues in brain health. The challenge there is that a good guideline is driven by a really firm evidence base. And emerging issues in neurology are meant to help frame some of that evidence base and maybe fill the gap as we wait for high quality evidence to accumulate so we can do that systematic review and then develop from that recommendations that we're confident in. That will be an important next step for the Quality Committee and the Guideline Subcommittee.
Well, thank you for your work already. To me, this paper symbolizes really an important step towards bringing brain health into the clinic. And that's something I think we increasingly need to do going forward.
Thank you, Gregg, for the opportunity to talk about it. This is exactly what we want our readers to see in this. But we also want to catch those folks who finish reading this article and realize that they have a passion for this challenge, a passion for this part of medicine, and ensure that we're connecting them with the right committees that can use that passion and apply it to these next steps. And that we're making sure that the opportunities that are out there that are building towards brain health within the AAN are available for all of our members. So we hope that we hear from a lot of interested people that will bring their skill set and their energy to this important area of neurology.
Well said, and I hope so too. Well, it's been a great pleasure talking with you today. I've been looking to this conversation for some time, and it absolutely did not disappoint. And thank you all so much for joining us on the podcast. Again, it's been our privilege to hear from Gregg Day about his paper published in Neurology titled The Neurologist's Role in Promoting Brain Health.
If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes, or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.